can edit all that out. So, hey everyone, I'm Mary. Welcome to Nurse Hack for Health. This is using design thinking to create nurse-led innovations. Feel free to throw questions in the chat as I'm talking or come off of mute and ask me a question. I'm happy for this to be more of a dialogue, but if you want to hold off till the end, that's cool too, whatever you're comfortable with. So I am the Director of Innovation at Penn Nursing. I'm also a founding member of SunCL and one of the organizers of the Nurse Hack for Health. I do a lot of teaching around human-centered design and design thinking. And so I do have some disclosures. I'm on a bunch of grants that is looking at using this methodology in practice. So I'm going to jump right in. So what is innovation? Like, we throw this word around, it's sort of become a buzzword. So I'm going to define innovation from the point of what we see it at Penn Nursing, which is the application of something new or the creation of something different that delivers value. And we're not just talking about technologies or widgets, though those things can be innovations, though not always. But we're really talking about is the methodologies we use to solve problems, the systems and processes we create, the way that we communicate with our patients, how we educate our students. All of these things can be innovations. So why do we need health and healthcare innovation? Well, as we saw during the pandemic, we really need to be able to rapidly create and implement new solutions to the problems we're seeing every day, whether that's pandemics or whether that's climate change or whether that's all these other things that we see at the bedside and out in the community. As some of you probably know, it can take anywhere from 10 to 12 to 15 years to get something from bench to bedside. When we're using innovation methodologies, we can really start to create and test solutions in weeks to months instead of years, which can really help us to rapidly then start to implement these things into practice. Using innovation also really allows us to more intimately understand the needs of the people for whom we're designing for, whether that's patients or clinicians or the community. And I'm going to go through that in a little bit during the empathy phase. And then finally, it really allows us to work with an interdisciplinary team of individuals. So not just healthcare providers, but really anybody who can bring knowledge and experience, including life experience, to the problem. So whether that's engineers or designers, whether that's community members or patients, really whoever can bring and add value to the problem we're trying to solve for, we want them on our team. So what is design thinking? So design thinking really is a human-centered approach that integrates the needs of the people. It is a 5-step process that starts with empathy and runs through define, ideate, prototype, and test. And though it looks like it's a linear process, it really is iterative, where you're going back and forth between each phase, always trying to iterate and learn more. And I'm going to go through each of these phases in more detail in a minute. So one part of human-centered design can be thought of like this double diamond approach. This first half of the diamond really wants you to make sure you're designing the right things, because we don't want to do what we have a tendency to do in healthcare and other fields and design things that people don't want. But also then designing things right, making sure the things that we're designing actually meet the needs of our end users. And so if you think about it through two conjoining diamonds, you're constantly throughout this process diverging, thinking bigger, discovering, and then converging, getting more specific. So if you look at this through the lens of design thinking, during the empathy phase, and again, I'm going to go through all these phases in much more detail, you're really broadening out, trying to think of who your problem affects with the widest net. And then you're going to get more specific when you're defining the problem, thinking about it through the lens, through the eyes of a certain population. And then when you're thinking about a solution in your ideation phase, you're going to broaden out again, thinking about every possible crazy idea that could potentially solve the problem you've just defined. You're going to create potential prototype solutions, and then you're going to start to test it, and that's where you narrow it down. And again, it's an iterative process throughout each phase where you're constantly going back, refining, making updates, and making sure the solution you're creating meets your end user's needs. And this process should look really familiar to nurses. The innovation process is the nursing process. So if you look at these 5 circles on the bottom, this is the nursing process. You're going to assess your patient, you're going to determine the problem, make a plan, intervene, and evaluate. It's the same thing as the design thinking process where you're empathizing, defining, ideating, prototyping, and testing. We just call them different things. Which is why nurses make great innovators, because we're already doing that at the bedside, out in the community, and wherever it is we practice, because it is our process and it's what we've been taught to do. So I'm going to talk you through a case study. I think the best way of learning about human-centered design and design thinking is doing human-centered design and design thinking. It is an active learning approach, but in lieu of that, I think a case study is really helpful to illustrate the different phases of design thinking and what really goes into each of those. And so I teach a class at Penn called Innovation in Health, Foundations of Design Thinking, where we have students work on a real health or healthcare problem in class, create low fidelity prototypes, and then test those solutions. So I'm going to use an example from the spring, just a bit of a trigger warning. This group looked at sexual assault survivors. So just as a warning in advance, I'm going to be mentioning a little bit of that as we move through the example of this design thinking process. All right, so the first phase of design thinking is empathy. This is really where you gain a much deeper understanding of the people for whom you're designing. So as researchers, clinicians, educators, we're not going out and telling people what we think their problem is, but through activities in this empathy phase, we're really allowing them to show us and tell us what they know their problem is so that we can co-create better solutions to address their needs. And we do that using a variety of different design thinking activities. Each phase of design thinking comes with a set of activities that you can use that walks you through this process. And so for this team, again, they wanted to look at the topic of sexual assault. Every healthcare topic has multiple populations that it affects. Whether it's sexual assault, whether it's cancer, whether it's gun violence, whatever. There's different populations and subpopulations within that. And so the first thing that I have my students do is define their audience. Think about who they want to solve the problem for, because not every solution is going to be able to meet the needs of every single type of person that this health or healthcare topic affects. And so they start by putting, the primary population in the center, and then the secondary, and then they work out to the outside circles to see who this sexual assault topic actually affects, and then they decide who they want to focus on. Once they decide that, they can really start the main part of the empathy process, which is the interviews and observations, really learning and understanding the problem in the context of where the problem occurs through the eyes, through interviewing people who were affected by the topic. So this group was decided on looking at young females who were recently sexually assaulted. So within 12 to 24 hours of sexual assault. So they started to go out and interview young women, interview nurses who worked at rape crisis centers, observing, really understanding what the young women were going through in that time period. Once they did their interviews and observations, they came back and they did something called an empathy map. And this is where you put your user in the center. So for this group, they're young female survivor, and they take all of the data that they heard and they saw in the interview and observations and start to put them into themes of what the survivors said, thought, did, and felt. Now, if you have multiple populations, so for example, if the students interviewed and observed survivors and also they did nurses who worked at rape crisis centers, they would do two different empathy maps, but we're focusing on the survivors here. So they just pulled out and started to look at themes of what the survivors, again, said, thought, did, and felt based on the contextual data they collected during the empathy phase. From those data, they take all that information and they create something called a problem statement. So this, again, happens during our define phase, where we take all the information and start to get a better understanding of what the problem is through the eyes of your end user. So one way to really start to contextualize what your end user is going through is to put together something called a journey map. If any of you work on quality improvement or process improvement projects, it's the same activity that you do in those areas as well. You start to jot down a timeline from a start point to an end point and list out all the different sort of pain points and other events that take place over that certain period of time that can tell you a story of what your end user is going through. And so these students created a journey map and then illustrated it using a storyboard so that they could take all of those data that they collected in the empathy phase that they started to put together in themes in the empathy map and really understand and pinpoint what they think the problem was that they were seeing and hearing from their young female sexual assault survivors. So I'll read this for you. This is Penny. She was just recently sexually assaulted and is feeling very overwhelmed. She knows that she has to go to the rape crisis center to report it, but she's really feeling very unsure and uncomfortable, not sure she's making the right choice. She meets with the sexual assault nurse examiner who tells her that they're going to do an exam, but first she has to remove all of her clothing for evidence, and they give her this really thin paper gown. And again, Penny's just feeling very exposed and unsure. The nurse then tells her that they need to examine her abdomen and that she's going to have to lift up her entire gown so that they can check out her abdomen. She's feeling very embarrassed and humiliated and thinks that she definitely did not make the right choice going there. So this is what the students gathered while they were doing their interviews and observations from actual sexual assault survivors and sexual assault nurse examiners. So from those statements and from that journey map, they put together a problem statement. So so if you can see, there's a template here that says I am user description. I am trying to goal or outcome, but problem or barrier, because root cause, which makes me feel emotion. This is like one of those old Mad Libs that your kids fill in. It's really a template that lets you think about all that information you got in the empathy phase and how to then put it together in a problem statement that reflects what your end users are going through. As with every phase of design thinking, once you do this, if you're not co-creating this with the actual end users, I have my students go back and make sure that they're checking in with the end users to make sure that the problem that they've identified is actually the problem that the end users are having. And if it's not, they work on it together to iterate it, edit it, and create a new one. So this team's problem statement reads, I'm a woman who was recently sexually assaulted. I'm trying to complete a rape exam so they may receive necessary medical care and preserve evidence. But the exam requires me to expose myself and be handled in extremely violating ways, reminding me of the actual assault, which makes me feel violated and uncomfortable. So once you have the problem statement set, you move on to the ideation phase. And this is really the phase where, like it says on the slide, you let your ideas run wild. I tell my students, don't worry about constraints, don't worry about funding, don't worry about physics, don't worry about anything. You want to get as crazy as possible with your ideas. Remember, it's the double diamond, right? This is the part where we're starting to diverge and cast a wide net and think about all the possible solutions to the problem that you've just identified in the define phase. And during this phase, you should always have your problem statement in front of you so that you are solving for the problem that you and your end user have identified, and that you don't have any sort of mission creep when you're thinking about solutions. So the first thing you do in the ideation phase is brainstorming. And I have the students do this individually within their groups and then come back together as a group so that they can think about different ways of brainstorming and then start to take all the ideas that they've brainstormed and bundle those ideas together to see if there's any themes that start emerging, again, around the problem statement that they've identified. But brainstorming only gets you so far, and most of us, when we're brainstorming, think about easy solutions, think about solutions that kind of already exist. And so there's a number of other activities in the human-centered design playbooks that sort of push folks out of their comfort area. And I don't have those in here, but so what I have the students do after they bundle those is work through 3 or 4 different activities so that they can start to think differently about how they are thinking about the brainstorming process. So one of them is called I Like, I Wish. And so is called what if. So thinking about what already exists in a different sector that you could potentially bring into the problem that you're solving for. So for example, I had a group of students that was looking at how to solve for food delivery problems in the in-hospital setting. And so they were thinking about, well, the problem is sort of like Uber Eats or DoorDash. So the students could create this app for patients where the patients could go on, look at the food that was available, order it when the patient was ready for the food to come, and then the patient could track where it was at in its preparation and delivery phase, similar to what we do all the time now with those types of apps, only it'd be for inpatients in the hospital so that they knew when their food was coming, and they could sort of plan other things. So that's one of the activities I have them do. There's also another activity called inspiration, where you think about the problem through the lens of either a brand or an individual. So for example, through Disney, how would Disney solve your problem? Or Netflix, how would Netflix solve your problem? Or, Willy Wonka, how would he solve your problem? Thinking about how others have done things and how you could take their inspiration and solve your problem. There's lots of different ways to ideate and to get more creative about ideation outside of your standard brainstorming activity. So after you brainstorm and ideate, you move into prototyping. So this is where you take the solution that you've come up with to solve your problem from your problem statement, and you create what's called a low fidelity prototype. So this is something that your end user can interact with that represents the solution in a way that they can then give you feedback. Generally, you want to create these things quickly and cheaply. So think about if it's a product, you're creating a potential solution out of, cardstock and pipe cleaners. If it's a web app or computer-based app, sketching them out on paper at first, drawing in the different buttons and the different fields so that the end user can see what the app is going to look like, but you're not spending hours and hours and thousands of dollars creating an actual physical application or an actual physical product. It's just something that you can hand to them that they can interact with, preferably in the environment where the problem's occurring, so that they can give you feedback. And so this group decided that they were going to create something they're calling the safety gown. They wanted to redesign those paper gowns that the sexual assault survivors were given, so that they were modular, so that if the nurse needed to examine the survivor's stomach, they could lift up just the portion of their abdomen, keeping their breasts and lower area covered. They needed to look at their shoulder, they could just put down the shoulder area, again, keeping the rest of the body covered and unexposed. So starting out on the prototyping phase, I have the students get visual, as this activity shows, so they can draw out what they're envisioning their prototype is going to look like. And then they move on to rapid prototyping, where they start to actually, again, create this low fidelity prototype that the end users can interact with. I have so this group of students started prototyping first on a little baby doll, but then moved on to prototyping for an adult as well. And so they're just using like old bed sheets, or even I think this is like a sheet from the hospital, to start to create their prototype. And at Penn Nursing, at Penn, we have a place called the Materials Library. It's part of our Penn library system that works with our students to help them come up with different types of materials to create their prototypes. And so this group was really thoughtful about how they were designing this gown. As part of the interview and observation process, they had heard from some of the survivors that Velcro and zippers were really re-traumatizing. If they heard Velcro ripping or if they heard a zipper being zipped, it would automatically make them feel like they were back at that traumatic event. And so the students were really thoughtful about how they were going to make this gown modular and in a way that didn't re-traumatize the women. Worked with the librarians at the Materials Library to get these really powerful magnetized buttons that they could just unclip and clip back together, and it didn't make any of those sounds that Velcro or zippers made. These are you only learn these things by doing interviews and observations with your end users, which is why the empathy phase is so important. All right, so after creating the low fidelity prototype, then you take that low fidelity prototype and again, you test it with your end users, again, in the environment where the problem is occurring, if possible. For this class, my students there's no time for them to go back and test with the end user, though they do send them, again, throughout each phase of the design thinking process, updates on, again, the problem statement, what the solution is they're thinking about, and then once they have their low fidelity prototype, they make videos of it. I have the students send the video along as well, being able to iterate based on feedback. So the students do this live prototyping or testing in class and get feedback. And as you can see, this is the prototype of the modular gown. These stickers here represent those magnetic buttons where you can lift up or down certain parts of the gown. And through the testing phase, you start to capture data. So we use something called the feedback capture grid, which captures from your end users likes, things you could work on, questions and ideas, as well as, I like, I wish, what if, I wish it did this, or what if it did X, Y, and Z. And you take down all that information from each of your end users who are testing your prototype so that you can take that information and go back and quickly iterate and make changes to it so that, again, it meets your end user's needs. And this was the team for the safety gown. I like to give them the credit because they did all the hard work. So I'm just going to briefly talk a little bit about equity-centered design. So equity-centered design really just allows you to think about how you're designing your products in a more equitable and just way for all patients and communities. And so it adds to the design thinking process this notice phase and this reflect phase. And again, like iteration, it's not like these are just bookend, but it's something you think about throughout the entire process of the design thinking approach. So when you notice, you're acknowledging your identity and your power as the researcher, as the healthcare provider, as the designer. You're bringing your own biases, your own experiences to the design process. And so you need to think about that as you're working through the process. But you also need to acknowledge and notice whose voices are at the table, whose voices are missing, whose are being silenced, whose are being raised up, and how you work to offset those so that if you do have co-collaborators, community members, patients who are working through this process with you, that this is really their lived experience, and you should be sort of stepping back and listening to them and making sure that you're addressing their wants and needs as you're creating this solution together. And of course, there's lots of activities and questions you can do to notice and reflect, to determine who has the power, and questions to ask yourself and think about as you work through the process. So as an individual, how does your identity impact your users' experiences? What are the important customs and practices at play at your institution that might affect your users' experience? And then structurally, what are the customs and practices that work together to include or exclude your user? All these things are really important to consider at the beginning, throughout, and at the end to make sure you're creating an equitable solution for your users. And this is just an illustration of, this is a mindset, and it's a process that goes through the entire design thinking process, again, not just bookending it. So I do want to mention we have a free online open access platform at Penn Nursing that we created in partnership with the Rita and Alex Hillman Foundation that teaches nurses about human-centered design and design thinking. It is an asynchronous platform curriculum with original lecture videos, original case study videos, podcasts, etc., as well as a curriculum set out of existing design thinking and human-centered design activities for each phase of design thinking that you can work through either to learn or to use in your clinic, in your hospital, in your health care academic education setting. We built this so that you can take the whole entire design thinking for health curriculum and create a whole course around it, or just take components of it to use in existing workshops and courses. This is a new case study we just put out a few months ago with Dr. Margot Brooks Carthon at Penn. She describes how she has used the design thinking process to create her project called Thrive, which helps socially disadvantaged folks who are discharged from the hospital. So I highly recommend checking that out. And just as a exciting stay tuned, we are in the process of actively updating the Design Thinking for Health platform with an equity-centered design base. And so we're redesigning all of the existing modules and creating brand new modules around Notice and Reflect to integrate equity-centered design into this platform. So hoping that will launch in early 2024. You can stay up to date with that by signing up for our newsletter at designthinkingforhealth.org. And I'll just mention, I host our Penn Nursing Amplify Nursing podcast, where we highlight nurses who are leading the way in science, practice, policy, and innovation. And we're launching season 8 at the end of this month. And the season 8, episode 1 podcast is about our Johnson & Johnson Nurse Innovation Fellowship Program and folks who attended our Summer Innovation Institute. So it was a really fun episode to record. So check it out. We had a really good time putting it together. With that,
Marion, there was a request to show the slide with the newsletter link again.
Oh, sure. designthinkingforhealth.org. You can sign up for the Design Thinking for Health platform and keep up to date on what we're doing. All right, so I think I will stop sharing the screen. If there's any questions, happy to stay on and answer them.